you don't have to live long in the Rio Grande Valley to know that it gets hot around here really, really quickly. And some of the ways to fight off that heat, to stop it from affecting you physically, some of those things are obvious, but some of those things not so obvious. And joining us on 710 KURV to talk about this is Dr. Joseph Pergolisi. And he is a kind of a specialist in this sort of thing. So with all the heat exhaustion, and we've got, kids that are getting ready for Valley High School football and all sorts of other outdoor sports, and everybody, it's just at the top of everybody's mind, ways to beat the heat. So what do you recommend?
Well, Zach, that's a great question. With more than 20 million Americans across the 16 states that are under the current heat alerts, that have been lasting since the first day of summer back in June 21st. The meteorologists are predicting that it's going to continue to be hot like this. And you're right, those people who are going to be out exercising in these record-breaking high temperatures and heat waves across the country, what they have to worry about is what can ignite or intensify pain. And this happens both for acute and chronic pain. The chronic pain disorders that can be affected are things like arthritis, multiple sclerosis, fibromyalgia, headaches like chronic migraines. These all can be affected. And what we need to think about are different ways that we can avoid the effect of this high heat index. And remember, the high heat index is a combination of heat and humidity. That even gets worse. So I can share 5 ways to extinguish pain that's sparked by hot temperatures that don't require a doctor's visit. And the first is go from the shade over sun, so move to a cool place. You want to stay hydrated. That means, drink enough water, but limit your alcohol and caffeine intake because that can dehydrate you. Wear breathable clothing and pack a bottle of water or a portable fan wherever you go. You want to stretch and rest as well, particularly if you get cramps. And then finally, you want to add pain cream before you put your sunscreen on. Let it absorb. So if you're already experiencing some aches in your joints or muscles, you want to put that on, let it absorb, and then put that very important sunscreen on.
I hadn't even thought about that. Because for me, I'm 34 and I don't experience any symptoms from any of these things yet. But I do notice that when the heat is on, I will get headaches rather quickly. But as far as pain cream before sunscreen, I thought that was fascinating. Kind of a way of just, so you take the extra time, you put the pain cream on the affected area before it's time to go outside, and then you put the sunscreen on before you go out. So you don't have to worry about like a reaction or anything between the two.
Well, that can always potentially happen. That's why I say you want to wait and let that pain cream or that pain rub absorb in. And then just before you go out into the sun, you want to put the other one on. And usually we don't see that.
Our guest on 710 KURV is Dr. Joseph Pergolisi. He is a specialist in pain and in dealing with the heat that can aggravate all sorts of things that you might not have known that you had until you went outside and it was hot. What are some other ways to deal with the heat? We talked about topical stuff right now. What about any pain relievers?
Well, that's a great question. When you look at the different type of pain relievers that we have, a lot of times we're going to look at oral agents, things you take by mouth, versus those things which you take by rubbing them on. And, why pain doctors prefer first-line therapy to come in the form of topicals is because you can put them on right where the pain is, like in the joints or muscles, and also they seem to work much faster because remember, the other ones have to be absorbed and then go through the whole body. And you usually could take a second or third dose more quicker than you would if you were taking an oral medication. So we like to think about taking the type of topical absorbed pain relievers as a first-line therapy.
When you're dealing with extreme heat, you're hydrating a lot, you're drinking a lot of water, trying to get those electrolytes up, And if you are taking a lot of pain relievers, do you just sweat those out a lot faster? Is it kind of counterproductive to take those, to ingest those?
That's a really smart question. And I think what we have to think about is when you're dehydrated, remember, whatever you're taking orally is going through your whole entire body, through your liver, through your kidneys. And some of these agents, if you're very dehydrated, could have a negative effect on those internal organs. That's also why I focus more towards the topical rubs. But it's not like you're sweating them out more. But what you're doing is you're increasing sort of the amount of medication that's being circulated around if you're very dehydrated. So there is a difference. With the topical rub, it's supposed to stay right in that area. It's not supposed to be absorbed. So that's why for the muscles and the aches, joints that may be aching, this could be a really good first-line alternative to something oral.
That's true. I was just thinking about that. When you read the box on the Tylenol, or the Advil, or the Aleve, it's like, I don't think they expect you to be overly exerting yourself in high temperatures when they tell you how to use it. That's a good thing to point out. We're talking to Dr. Joseph Pergolisi. He's a pain specialist. He's our guest on News Talk 710 KURV. Why is it that people can experience more pain in hot temperatures compared to the cold temperatures?
That is a really good question, and I wish I had strict scientific evidence to back it up. But while the science supporting the link between temperature changes and pain is not fully understood, it is commonly reported phenomenon throughout the medical literature. And you see that patients who have chronic pain conditions like arthritis will complain when it's very cold or when it's very hot. And we're not sure exactly what's going on, but we do know that people with arthritis, it's more common for them to feel this type of extremes in change of temperatures to feel worse pain. And this can happen quite often. Multiple sclerosis, this is something that affects your nervous system, and anything that rises the body's temperature, including a hot summer day, can even worsen MS symptoms to the point where some patients can complain of vision problems. Fibromyalgia, that's a real bad one to have. And overall, it's been reported that many people with fibromyalgia have what we call temperature sensitivity, or worsening of their symptoms with extreme temperature fluctuations, either hot or cold. And even the National Fibromyalgia Association supports the link between weather and fibromyalgia-related pain, although they state it's generally worsened by cold and humid weather. And finally, chronic headaches and migraines. Temperature changes are commonly cited as triggers for both migraine attacks and tension-type headaches. And even the more simpler temperature fluctuations, like the heat of the summer, can lead to dehydration, which then can trigger the headaches or the migraine attacks.
So you recommend staying hydrated? You recommend using the pain creams rather than the ingestible painkillers via pill or what have you? Stretch a lot, rest a lot. Are there any other things that we can do to help manage it?
Again, let's look at just some simple things that don't require a doctor, and that's going from the shade, going into the shade, getting out of the sun. That just makes a lot of sense. Wearing breathable clothing, that's important. I've seen some people this summer with these portable fans that go on their iPhones. That's pretty cool idea too. And I'm like, where did that come from? So that's a pretty cool idea. I will tell you that there are some red flags and yellow flags that you need to think about if you are experiencing a lot of pain during heat. And the first is that you want to rest, you want to hydrate, you want to cool down, just like you said. But if that doesn't alleviate the heat cramps, you do want to seek medical care. You want to talk to a doctor immediately if your temperature doesn't come down and you've tried to do all this, or your symptoms get worse. Important for parents with babies, Babies experience temperature sensitivity more, and babies require follow-up medical attention for heat-related symptoms, even if they get better at home.
Where can we find more information on managing pain, especially in times of extreme heat?
Sure. There's my website, which is www.drpergolisi.com, and that's DrPergolizzi.com, drpergolisi.com, or you can look at Healthy Directions. And I think the Healthy Directions site is a great place to look. You can also check out the different types of foods that help fight pain. I know a lot of people always ask me about that. And a really nice article on The Heat is On, discussing what pain can do to exacerbate these chronic pain conditions.
Dr. Pergolisi, thanks a lot for stopping by. That's Dr. Pergolisi, Joseph Pergolisi, joining us on News Talk 710 KURV.